Hey, welcome to the Right Focus Healthcare LLC educational channel. This video is going to be a short review for primary care nurse practitioners about the most common diabetic medication, especially the metformin combined with other drugs. If you're new to prescribing diabetic medication, I recommend watching my earlier review on oral diabetic medication. There is a video there where I explained the different classes of medications, how to identify each classes and their generic names. So this will be an easy video for you. In this video, I'll only focus on common combination medications with metformin, their names, their dosages, and their action and their comparison. So please watch the oral diabetic medication review first for a complete understanding before going into this one. As we all know, if you have watched the video on oral diabetic medications, in diabetes, we choose medication based on the patient situation. What is important, A1C reduction, or the patient need cardiovascular benefit, or weight loss, or cost is a concern. So sometimes one class of medication is not enough. That's when the combination therapy comes, and we can combine the benefits from two classes in a single pill, and there is a significant A1C reduction with one pill. Some common examples are like metformin combination with a DPP4 inhibitor, Janumet, and then metformin with SGLT2 combination, which is helpful for blood sugar control and cardiovascular or renal protection. So which are examples are Synjardy and Xigduo. Let us discuss the advantages and disadvantages of these metformin combo medications. Number one, it combines insulin sensitization, which is the mechanism of action of metformin. You know, metformin belongs to the class of biguanides, and with the same we get the benefit of DPP4 inhibitor and SGLT2 inhibitor. So we will discuss that in a minute. And then number two, it improves the A1C control. We are getting an additional A1C reduction with a DPP4 combos, an additional A1C reduction of 0.5 to 0.8%, and with SGLT2 additional 0.5 to 0.7%, in addition to the metformin A1C reduction about 0.5 to 1.5%. And also, these combo medications allow lower dose of each drug. What that means, there will be less side effects from each medications. And also, less number of pills. Instead of 2 pills, there will be 1 pill. Then what are the disadvantages? The same that we discussed about advantages, there will be side effects of both class we need to be educating the patients about. And then we cannot titrate separately, each class of medication separately. Then the cost of these combo medications is higher than the single agent. Next is the metformin combinations with the DPP4 inhibitors. I am only talking about the level of primary care nurse practitioners. So I'm only talking the most common medications and the least risky ones. So the first one is Janumet, metformin plus sitagliptin. So how the name comes, it's a Januvia is another name for sitagliptin. So Janumet is a combination, and the Januvia, the doses are from 25 to 100 milligrams. So 50, 500 milligram, 50,000 milligram twice daily, and you can increase up to 100, 2,000 milligram. Then next is a Jentadueto, metformin plus linagliptin. Another name for linagliptin is Trajenda. So that is why Jentadueto is the name. And the dose, you can see that it's the same, 2.5 500 milligram, 2.5 850 milligram, 2.5 1000 milligram twice daily. How do you compare Janumet and Jentadueto? Janumet is, as we discussed, sitagliptin plus metformin. Jentadueto is linagliptin plus metformin. Janumet usually immediate release, and sometimes XR is also available. And Jentadueto usually immediate release. Sitagliptin in the Janumet is well studied and widely used and has a long history and extensive clinical data. So it's very widely prescribed globally, while Jentadueto is approved but less known in some place and is also less widely prescribed. And both of them are prescribed usually twice daily. And Janumet, sitagliptin requires metformin dose adjustment in renal impairment. Linagliptin does not require dose adjustment, but still we need to adjust the metformin dose. We can educate the patients about the side effects of metformin, which is GI symptoms, nausea, vomiting, diarrhea, and also myalgia. And regarding the DPP4 inhibitors, there is nasopharyngitis, severe arthralgia, and also hypersensitivity reactions like urticaria and angioedema. Now next, let us discuss the benefits of adding a DPP4 inhibitor to metformin. In the advantages slide, we discussed that the metformin primary action is to improve the insulin sensitivity. So by adding a DPP4, we are getting an improved A1C reduction, which is 0.5 to 0.8%, and also we are getting the another mechanism of blood glucose control, which is a DPP4. The mechanism of action is that DPP4 is an enzyme that breaks down incretin hormones like GLP1, which helps the insulin release soon after the meals. So by blocking DPP4 or these DPP4 medications, what they do is that they prevent the breakdown of incretins, so more incretin hormones remains in the body, so that leads to better insulin secretion and lower blood sugar, especially after eating. So since this is related to the insulin release after the meal, there is lower risk of hypoglycemia, and these medications does not cause no weight gain, typically weight neutral, like the sulfonylureas and insulin can cause weight gain, and there is a mild side effects and better GI tolerability compared to some of the other medications. And also these are good option for patients who can tolerate SGLT2 inhibitors because of their side effects, or GLP1 agonist because they are not candidates for injectable therapies. So and also this is well tolerated and safe in elderly because of these less side effects, and these DPP4 inhibitors can be used with the dose adjustments in renal impairment. That's a good point of these medications. Next, let us discuss about the metformin plus SGLT2 inhibitor combination. So, number one, Xigduo, metformin plus dapagliflozin. The name comes from dapagliflozin, another name is Farxiga. So, the Farxiga Sig is Xigduo. And then the regular Xigduo is not marketed in the US, and most places only have XR. The XR comes in 500 milligram, 5000 milligram, 500 milligram, 10,000 milligram, once daily. The next one is Synjardy. It's metformin plus empagliflozin. Where the name come from? Empagliflozin, another name is Jardians, so it's Synjardy, the Jardians name. And then the regular is 5 by 500 milligram and 5 by 1000 milligram. It's twice daily. XR is 5000 milligram, 12.5 thousand milligram. It's once daily. What are the side effects of these medications? These medications can cause polyuria, so there will be more UTIs, more genital infections, and less common ones are dizziness, hypertension, and also some electrolyte changes. I'm not discussing the medications which are canagliflozin or invokana combination because they can cause fracture risk and also lower limb amputation. And these medications are contraindicated in eGfr less than 30. Now let us discuss what are the benefits of adding an SGLT2 inhibitor to metformin. We already discussed the metformin primary action is to improve the insulin sensitivity. So by adding SGLT2 mechanism, we are getting better blood sugar control. So there is an additional A1C reduction of 0.5 to 0.8%. Then what is the mechanism of SGLT2 inhibitor? SGLT2 is a protein in the kidneys which helps reabsorb glucose back into the bloodstream from the urine. So these SGLT2 inhibitors block this protein from reabsorbing. So glucose is not reabsorbed and instead is excreted in the urine. So this lowers the blood sugar level and also causes some loss of calories, which can help with the weight loss. Also, since its work, the glucose is excreted excreted through urine, it's independent of insulin. So that is why there is lower risk of hypoglycemia. Then the cardiovascular benefits, it reduces the risk of heart failure, hospitalization, and major CV events. And then the kidney protection, it slows the progression of diabetic kidney disease. How it does that? It reduces the glucose absorption, so there is decreased glomerular distraction, and also there is less fluid overload. And then because of the reduced preload and afterload, there is blood pressure lowering, so there is decrease in systolic blood pressure. Next, the most important point for nurse practitioners to remember, always check eGfr before starting or continuing metformin combos, and it is contraindicated if eGfr is less than 30, and do not start if eGfr is 30 to 45. We can refer to endocrinologist or nephrologist. And then the reason is that there is increased risk of metformin associated lactic acidosis, which I have explained in the video of general oral anti-diabetic medications. So please refer to that video. And before I conclude, I request any nurse practitioners or any providers who is listening and getting benefited and enjoyed this video, please subscribe to this channel so I can make similar videos. So I'm concluding here. In summary, in this video, we learned that by adding DPP4 or SGLT2 inhibitors to metformin, we can improve A1C control and more cardiovascular benefits for the patient and prevent progression of their CKD or chronic kidney disease. And we can use them safely in elderly patients, and also less hypoglycemia risk. So depending on what is most important for the patient, we can select the combo. So I hope you enjoyed this video. Thank you again.